32 questions about orthodontics. Are you interested in being an orthodontist? Are you getting ready to apply? Have you done some shadowing? Have you taken the GRE? What's a typical day like as an orthodontist? How many programs should you apply to? Are you actually an ideal candidate for orthodontics? These questions and more are coming up as we talk to board certified orthodontist about all things orthodontics. Stay tuned. Hey, this is Dr. Darwin, a new dentist coach, another episode of Ask Dr. Darwin on the New Dentist Podcast Show, where we talk about getting into dental school, getting into residency, and then life as a new dentist. Be sure that you are continuing to support and comment and share this channel with those of you, those that know you, but also those that you know who are seeking help, but also information and resources about life as a dentist. Also, this episode of Ask Dr. Darwin is being brought to you by Get Into Dental Residency Challenge. Get Into Dental Residency Challenge, right down here. The ultimate resource, 4 hours, 4 days of 4 hours, 4 days of training to jumpstart your dental application for residency. For more details, go down to the link below and come on and join the challenge. All right, today we're going to be talking about 32 questions for an orthodontist, 4 quadrants of questions. This is a video series where we ask questions that highlight the different dental specialties and focal areas within our profession. Why? To gain insight as a practicing dentist or a specialist, and so that it'll help you as you are navigating your journey to your specific area within dentistry. All right. So we're just going to jump right on in. Orthodontics is the topic for today. We're joined with a former resident, both as an ortho resident, but also a general practice resident who is now a board certified orthodontist. So we're just going to jump right in. So, Doc, please introduce yourself, give us your name and where you're from.
Good afternoon. Thank you for having me. I am Garrison Copeland, born and raised Cleveland, Ohio. I went to undergrad at Morehouse College, went on to dental school at Howard University, and then did my orthodontic training at Case Western Reserve University. I did something a little different than most. 7 years into my ortho career and how I met Dr. Hayes, I actually went back and did a GPR, which was an amazing experience. Multiple reasons why, but I love dentistry in general. I do see how the flow of the market is going, where I don't think it's a bad idea as an orthodontist to be able to expand on your skill sets in dentistry. And also, I got to correct you. I'm actually not board certified for that reason, because if I choose to take on more than just orthodontics, you can't if you're board certified. So I'm excited to be here. Thank you for having me. Let's get it going.
Absolutely, man. Absolutely. And let's get it going based on how you started getting it going. So you mentioned undergrad, Morehouse?
Yeah.
Okay, Morehouse. Okay. Now, what was your major at Morehouse?
I was actually a finance major. It had nothing to do with science at all. I took the prerequisites to get in dental school, but I initially felt like I wanted to work on Wall Street and live in that world. I did 2 internships, the Fortune 500 corporation. I didn't like it. And so I pivoted to dentistry.
Gotcha. Now,
So
between Morehouse and dental school, did you take a gap year or take a transition year at all?
I didn't. I did not.
Okay. Okay. All right. Speaking about dental school, Howard University, right? What was the thing that you liked most about dental school? What was your favorite thing or favorite part about dental school that you liked the most, would you say?
The relationships. I met great friends there. And we're still in contact, close. We have our group chats. We sing each other all the time. But really, the relationships I was able to build out of dental school is probably the best part that I remember.
Yeah, those relationships last a lifetime as well. That's great. What was the least favorite part or the thing that you did not like about dental school?
Dental school.
Short list, because I can still remember some things for myself, and that's been over 20 years. So yeah, short list.
um, it's taxing. I'm not gonna lie to you, it was challenging, especially as a finance major. It kind of hit me like a ton of bricks that freshman year. But it's part of the game.
Yeah. Yeah, it's taxing time wise, mental wise. Your life is not your own, so to speak, right? Um, how did you overcome that part of the fact that it's very time consuming, but also different, a different learning environment, whether you're a non-traditional student who has a major that's not typically or traditionally science, a science background. How did you overcome um, some of the challenges?
It's a great question. Um, I would tell anyone considering dental school, before you get in, understand how you take in information. I'm an audiovisual learner, and I didn't even understand that until halfway through freshman year. So one thing I've noticed about me is that I have trouble paying attention after roughly 40 minutes. And in dental school, these lectures can be 2, 3, 4 hours. So if you're sitting in classes trying to take as best notes as possible and your attention's going here and there, you're never going to fully grasp what the attending is trying to convey to you. So what I did is I actually would ask the attendees, can I record the lecture? And I would record every single lecture. And then at night, I would go home and transcribe the notes on the PowerPoint. So I have the attending saying, plus the photos, that made a world of difference for me in dental school. Because again, I'm not your traditional biology major or whatever major, but understanding just how I properly take in information catapulted me through and enabled me to position myself for orthodontics. So that's the number one thing I would tell any student considering dental school. Before you get there, you should understand how you best take in information.
Yeah, that's so key. And I know when we were in school, I was in school, we had this thing called note service. I don't know if those that are listening and watching have a note service at their current school where we had just that. We had a recorder, a tape in the front of the lecture of the faculty member. And in the evenings, if you were part of the note service team, whoever was assigned to that class, that lecture, they would go back and transcribe what they were listening to. And then that would be part of a package that's sent out, mailed to you in your school mailbox slots, given to you on a daily or a weekly basis to supplement. Of course, now, as Doc knows, and we know too, there's a there's a there's an app for that, right? They got apps that do all of that now on your laptop where you can just they just listen to the lecture. Not only do they transcribe the notes, but there's a features where they will create flashcards. It creates multiple choice questions for you. It's crazy. It's crazy. So, but good point.
Technology.
Yeah, the technology, but good point about understanding or the importance of understanding how you learn the best. Um, so was that a response of some of the things that were hard for you in dental school? What was the hardest part for you, would you say?
Probably not. I really didn't understand how I properly taken information the first semester, and that
Okay.
was a battle. It was a real fight. But coming into the second semester of freshman year, I decided to record lectures, go home and transcribe, and then it made a world of difference for me.
Yeah, big difference. So those first days of dental school, did you know that you wanted to specialize in ortho, or
100%.
you did? Okay. And what was that based off of? How did you know you wanted to be an orthodontist?
Here's what I went through as a child. I had severely proclined teeth, large spaces between my teeth. Used to get picked on and teased, And then after I got braces, all of a sudden the world treats you a lot different. So that transformation and improving the way someone feels about themselves was the main reason I was like, this is for me. This is what I want to do. And again, it's just a childhood experience. Also, on top of that, the first African American doctor I ever had was my orthodontist. And so seeing this young guy with a white coat on who was a relaxed, cool guy, an orthodontist, it made me think to myself, well, maybe this is a possibility for me. Because no one in my family are dentists. There's no doctor in my family throughout our entire lineage. I'm the first one. So um, sometimes seeing yourself in the role can make a world of difference. I just actually joined 100 Black Men. It's a organization that mentors young people in underprivileged areas to help them see the possibilities of what they can be when they get older. So between horrible overbite and my first Black doctor being an orthodontist, I knew I wanted to do this at a very young age.
Yeah. And that's key. Very important. Seeing yourself before you become yourself, or en route to becoming yourself, right? Seeing yourself in other people. Seeing is believing as
Yeah.
well. So we're going to transfer to now to the second quad of questions related to ortho. Um, you mentioned that experience of your own orthodontist who looked like you, and that was key for you in being able to catapult your next step in becoming not only to go into dental school but also become an orthodontist. What else about ortho made you fall in love with it? Besides that first experience, were there additional experiences, whether before dental school, during dental school, that made you that like reconfirmed, "Oh, yes, ortho is for me."
One thing I love about ortho is that you don't have to make a split decision. Nothing is like life or death today. I have to make a decision for this patient. You have someone who comes in who has a challenging skeletal discrepancies or vital, whatever, however you want to look at it. You can take diagnostic records, give the patient an idea of what the plan will be. But then that evening, once everyone's gone, you can sit in front of the computer and just really take your time and develop a proper plan for that patient. Nothing is, you don't have to make any decision right now. And I never do that. I mean, when I was in residency with you, I mean, we were working in the ER, we had to make decisions in the moment. And I would prefer to be able to take my time and to get the best plan possible for each and every one of my patients. So I love the fact that I can just take really good records when everyone's out the office, it's quiet, and I can just really study my patient and put together a great plan for them.
Now, regarding training, um, for ortho, what's for those that are exploring it right now? How long is training for ortho, including um, if people decide to do any type of special fellowships or any research? What's typically the pathway for the training process of becoming an orthodontist?
Well, I mean, as we all know, senior year, you can apply. If you get directly in, looking like residencies are anywhere between 2 to 3 years usually. Mine 2.5 years. If you don't get in right away, a fellowship is a phenomenal idea. Case Western Reserve has a craniofacial anomaly fellowship, which is a clear path into orthodontic residency and that program if you do it. Not to mention the fact that you're broadening your scope of the number of patients you can help and you understand things of that nature. So if you get right in, awesome. If not, do not give up. You'll make it. You just gotta position yourself either with research or fellowships to do that.
And if we get a chance, we'll talk a little bit more about that pathway and ways to kind of strengthen yourself as an applicant because that's key. Um, what also is key is understanding what makes ortho unique, right? In comparison maybe to other disciplines and specialties in dentistry. What do you think is the most unique part about ortho? What makes it so unique and different from other components, other disciplines in dentistry?
The transformative effect. No, that's not completely unique because a prosthodontist can do the same thing when you provide lower dentures. But I always say, I joke, no one's ever died from an overbite. The quality of life is so important. So being able to instill in someone confidence in themselves opens up doors for them in ways that we haven't even measured yet. So the transformative effect of orthodontics, I think, is somewhat unique. Um, Also, you don't have to make a split decision, like I just said. Like, you can really just sit down and study your patient while they're away and put together a plan that's going to be special and unique for them to transform their life in a positive way. So nothing is immediate in orthodontics, which I absolutely love. And I also enjoy explaining to the family why this is important. I'm in scrubs right now because I had a patient come in, this expander was bothering them. And I was able, because this is only patient today, walk the family again through why it's so important to remodel the jawbone. He has a canine growing on top of the root of a lateral, and we're going to put mesial root tip into the lateral, protect the root while the canine develops. And the father thanked me at the end. He was like, wow, you really make this easy to understand. So being able to break it down in a way that someone who didn't go to dental school can understand is also a great part of orthodontics as well. So I mean, I don't know if it's unique, but these are the components that, for me, really are main reasons why I enjoy this field so much.
Who or who should consider doing ortho or becoming an orthodontist? Who is it for? Best for, do you think?
Those who are analytic, like I said, a lot of orthos is up here. Like we're going to get into later what a day with an orthodontist is like, and I'm going to blow you away with some of those questions. But a lot of what we do is just up here. So if you're very cerebral in your approach to things, then this is a great field for you. And then also, more importantly than anything else, you shouldn't step into ortho unless you're passionate about changing someone's life for the better. I mean, this is what we do. I can not tell you how many times I've had someone get the braces off, their Invisalign done, and they tear up because they're so happy about their new look, the new you. And that's the best part of orthodontics to me, is that transformative effect that we can have on people. So if you're not about that life, then this is really for you.
Gotcha. So let's flip it. Um, what what are some of the things that people who well, let's flip it. Let's flip it as it relates to why should someone not choose ortho? I know you mentioned uh, if you're not cerebral,
Cerebral.
cerebral in your thoughts, not passionate about, creating a transformative change. Who else is ortho not for?
I mean, some people are just more passionate about, action and getting in there. Like dentists who take emergency appointments and they do the pulpectomy right there on the spot, and then they're setting up for the root canal later. Some people are passionate about that. That's not the world of orthodontics at all. Um, Artistic. If you're not a very artistic person or don't have like great hand skills, um, it's really not for you at all either. And then, there's a lot of detail involved. There's a lot of detail with orthodontics involved. So you got to be very detail oriented if you're going to step into this field.
Now, what part of the artistic characteristic is key? Like, what do you mean being artistic? Being able to visualize what the final result will look like as far as art in that way, or what do you mean for what do you mean by artistic?
Well, to be honest, straight teeth is not enough, in my humble opinion. As we all know, as dentists, teeth come in all different shapes and forms and sizes and colors, and the edges are always a little beat up, especially in adults. So one thing that I do is, after I've perfected the alignment, perfected the occlusion, I go back in and reposition the social six. I'll do enameloplasty to smooth the edges. I'll make sure the gentle architecture is perfect. And again, that's like the last, is the finish and detail portion of my treatment. And that's more the artistic component that I'm referring to. I worked with a doc who didn't have that kind of hand skill, and he just didn't mess with it. He would give it to me. He's like, "You do that part," But yeah, if you're not artistic is it's not a good look for you either.
So it sounds like artistic in being able to finalize the smaller details that make the smile not only function as far as biting and closing the spaces, but also artistically or maybe cosmetically make beautifying the smile based on the teeth and how they're arranged to make sure that they are proportionally even. You said the social six for those that are listening and watching. Those are the front six teeth, three to the left of your midline and three to the right of your midline. The teeth that people see in the front, in addition to if they look at you or you smiling from the right, there's actually a couple more teeth that go in there as well. But that's what the social six is. So making sure that that area of your smile artistically, cosmetically, naturally you know, look like perfection, so to speak. Gotcha. Any stereotypes uh about orthodontists?
Uh, we don't work very hard. I work in a couple different I work in a couple different multidisciplinary practices, and I'll talk to you guys about that too. When you first open a practice, you don't quit your other jobs. You still work your other jobs. You just have your office open 1 day a week because your practice really isn't going to sustain you the first couple of years. Every dollar that my practice makes, I reinvest back into the practice. So these other jobs I'm working are what pay my bills, pay my student loans. So with that being said, one of the multidisciplinary practices I'm in, like a lot of times I'm just standing at the door watching my assistant do a procedure, and like there's a GP down the hall doing knee deep in a root canal, and so they mess with me a little bit about that. But so I guess that might be a stereotype. But again, a lot of orthos up here, so if you train
Yeah,
your staff well, they can do these procedures.
yeah, and it's also I think the whole notion of, oh, he's not working hard, she's not working hard. Well, a lot of that work has already been done in the treatment plan, right?
Exactly.
And to your point, on the multiple visits, there are some fine tuning that has to be done, but you also need the time of that fine tuning you need the time of the tuning to see if what you have treatment plan is working or it needs to be updated, right? So you still need time that you won't necessarily need to have in the chair, because once they leave in 2 weeks or 6 weeks, 4 weeks, whatever that time interval is that takes the tooth to rotate, move, upright, etc., happens outside of the office, right? So once you make that decision, okay, we're going to upright, we're going to put this, we're going to do A, B, and C. Once that's decided upon, it's very instantaneous. So yeah, I can see where people will say, "Oh, they're not working, they're not doing nothing." So it's true, but it's not true. You have to understand what you're observing, knowing that it starts from the treatment plan and beyond. All right, so good. So let's pivot now to our third quadrant of questions related to um, the actual day of an orthodontist. So what's your typical average day or week look like?
So, I mean, as you all know, we also are businessmen as well. So it depends on the business model. I actually work in a variety of different ones. So it's a great question to ask me. One model, we accept most insurances, including state insurance. So I see 100 patients in a day. Yeah, and I have maybe 3 assistants, and I make 100 decisions a
Hold
day.
up, hold up, hold up, hold up. I don't think they heard that because I heard it, but maybe I didn't believe. You said what? 100 patients in a day?
100 on the schedule. You walk in the stores, 100 patients on the schedule.
How many? Well, go ahead. I'm gonna
Now,
let
there
you
are some
finish. I'm gonna let you finish.
cancellations. I will say that there are some
Yeah.
cancellations. So it might get knocked down to like 80, but yeah, you're seeing a handful of people in a day. That's one model, but that model is more for when you accept a lot of different insurances. I work in another high-end office in Manhattan, Midtown East, where they charge close to $10,000 per case. And yesterday I was there and I saw 10 people. So it depends on the business model. And the Manhattan office, there's celebrities that are there. I can't say names, but it's much more higher end. And then the practice that see the 100 patients is more community based, trying to make the smile possible for as many children as possible, which I love. But we do see a lot of people on that day. So yeah, it just depends on the model. And there's everything in between. I used to work in a practice upstate, and it was slightly above blue collar. So I might see 50 people a day there, and their case fees were closer to like 6,000, 6,500. So it just depends on the model.
So based on those models and where you are um, on that particular week, that those different days, are your days full more of treatment plans or follow-ups, or how do you typically like to arrange your day? 6 hours, 8 hours, 10 hours. How do you particularly like to do you do some block scheduling? Like how do you arrange your day?
I mean, you hit it on the head. It's all about the treatment plan. If you have a strong treatment plan, you're just playing it out at this point. Now, the great thing about orthodontics, it is fluid. So every single time a child comes in, if I need to veer off or go a different direction, I will. But I really put a lot of effort into my initial plan so that I'm just posting through and making sure the child gets that perfect result. But with that being said, my typical day, like I said, do not quit your jobs when you first start practice. I work 9 to 5, usually in some practice. Then I drive quickly to my office, and from 6 to 9 at night, I'll see patients in my office. So I usually have a 9 to 9 day. I try to go to the gym in the morning. I work out at night, drink a gallon of water a day, but there's not a lot of free time right now just because it's new. God willing, one day, it'll be a little lighter schedule. But right now, early on, anyone looking at building an office or practice, this is what it looks like. Sunday morning, I just saw a patient. I mean, hustle and grind. You just got to do what you got to do. Did I answer your question? I think that's what it was. Yeah.
Yeah, and that hustle and grind also is from 9 to 9, but there also can be, like you said, it's not necessarily a 9 to 5. It's not necessarily Monday through Friday. Things happen on the weekends, brackets, things, treatment, people's availability, right?
Right. And
Is
you also asked about blocks. Real quick, sorry to go back.
no.
I try to schedule the longer visits in the morning. For example, if a child's getting upper and lower braces, that's usually a morning appointment. The afternoon is really built for the adjustments because one, in orthodontics, you're seeing that child either 4 to 6 to 8 weeks. So you want to limit the amount of time you're taking the child out of school. So we joke about this in orthodontics, but from 3:30 to about 5, it's rush hour because parents get their kid from school and they want to get them into the orthodontist without having to missing school. So you'll see it on the orthodontic schedule, roughly 3 to 5. It's nothing but like 15-minute adjustments, and it's like 1,000 of them. So you're thinking, yeah, you're moving from 3 to 5. Now the mornings again, taking braces off, putting braces on, putting on attachments for aligners, still longer appointments, 40 minutes to an hour. The mornings are a little bit lighter because of larger blocks. Then you put your skates on at 3 o'clock because we're moving.
So as you're moving throughout the day, in the morning and then also in the afternoon, what would you say is some of the hardest procedures, or typically what can be the most challenging procedures that you have?
There's not really that many hard procedures. Biggest thing I've noticed is just a lack of arch length for teeth. So, for example, um, you have a 8-year-old coming with a mixed dentition, and you notice, like this morning, the adult canine is literally growing on top of the root of the adult lateral incisor. And I've literally seen children where the root has been engulfed or they've lost the root of an adult tooth. So remodeling jawbones, incorporating mesial root tip into teeth. Right now, I have a little girl who's an impacted canine that's transposed. The lateral is diagonal, so I had to bond the bracket to maintain distal root tip, distalize the tooth to bring up the other tooth. Like dancing roots around teeth within the jawbone, I guess, would be the most challenging thing. But there's not really a lot of challenging procedures in orthodontics. It's really not. When we do a lot of the same stuff every single day, I think the only real challenges that we face, and maybe other orthodontists would say differently, is with the staffing. Um, if you have, for example, you walk in, you have 100 people on the schedule, and you're staffed for 3 assistants, but then one calls out, you in trouble. Like that's gonna be a rough day. You know what I mean? Now you only got two, and you got 100 people on the schedule. So managing the staff, uh, that's probably the most challenging part.
Yeah, and that makes the procedures a little bit not challenging, but you gotta be more hands-on, and you may not be able to see as many because you have less support and seeing those individuals. What's the most common? What are the most common procedures that you're seeing on a daily, weekly, or annual basis related to either treatment plans or different modalities of getting teeth aligned? What are some of the most common and most routine things that are coming out of ortho, at least in the offices that you're working in, the treatments that you're performing?
Like what common are just basic adjustments. You're graduating wires to the next, the next, the next. You're moving, closing spaces or opening up space. That's what we typically do on a daily basis. You're tracking aligners, and if they're properly moving the teeth the way you designed it. Those are like the typical procedures you do in a day. Obviously, you'll do some bondings in the morning, but usually it's just adjustments.
Are you seeing a higher number of start cases that are starting and people wanting treatment using aligners versus traditional?
I always tell patients both are great options, whether you're aligners or braces, but you know yourself best. If you're the kind of person that's going to wear that thing 20 hours a day, aligners are a great option. If you're like, you know what, doc, I want you to do all the work, then glue some brackets on and then just sit back and let your teeth move. So I personally in my office have seen a lot of braces. Like even my adults, they want braces. Um, when I was working upstate, they pushed aligners, so there were a lot more aligners there. The Manhattan office I'm in, it's almost all aligners. I have some bracket cases, but a lot of aligners. So to answer your question, it's more about the environment you're in. And the most important thing a doctor can do is just explain everything to the patient on the front end. Your teeth are not going to move unless you wear your aligners. It's like just as
Right.
I had a patient yesterday. He's been in aligners forever, and I was like, are you getting 20 hours a day? And he was like, man, I think I wore it 3 times in the last month. I said, well, we're not going to get anywhere. So I put brackets on him that moment. Like, what are we doing? So you know yourself best as a patient, and
Right.
both I love like working with Invisalign and those because I get to design the smile on their website, and then all the patient has to do is just wear the trays, and it lines up beautifully. It's a great system to use. But I also love brackets too because with brackets, yeah, I capture a lot of detail with the brackets. So both are great options.
Yeah.
You know
Yeah.
yourself best as a patient.
What's the most memorable case that you've worked on that gave you the best feeling? Like you're
I wish I could show you. I wish I could show you a photo of it. It was a little girl. Not little girl. I mean, she was 22, but her parents were never able to get her braces at a young age. She never smiled. Very poor self-esteem, and got her into brackets. Designed the smile. She looked phenomenal. I mean, she can't stop smiling, and she teared up at the end of her treatment. She was so grateful for change that I was able to trade for her. And that's the best part of orthodontics, the absolute best part of orthodontics, being able to really transform someone's life for the better.
the flip of that is some of the toughest part about orthodontics. What's that for you as a provider who's also an owner on the business side and then also a team member in some other offices as well? What do you think so far has been the toughest part about this overall role or the combination of the multiple roles that you've have held and continue to hold as an orthodontist?
And actually, great question. I don't know if you guys know, I used to be a partner in a practice when I was a child. The orthodontist that I told you about earlier, that was my first job coming out of residency. We worked together for 7 years. We went from 2 offices to 7 offices, and we were partners the second half of those 7 years. And the biggest, to answer your question, the biggest challenge we had nothing to do with braces or aligners or treatment or anything. It was managing over 50 employees and the things that arise when you have that many people working for you. I have stories for days that I'm probably not allowed to share, but managing the staff and keeping everyone on the same page and putting out fires every day, that was really the biggest challenge as orthodontists. Because humbly speaking, we don't know a whole lot about HR. I can straighten teeth out like that, but understanding how to properly manage this person doesn't like that person. This, you know, I have stories for days. So, anyways, staffing to answer your question.
Yeah, yeah, yeah. If HR was a tooth, it would be a home run, right? It would be an actual HR. It would be a home
Well,
run, but
yes,
that ain't it. That ain't it. All right, let's talk about some lifestyle and fun things related to you and how you, as an orthodontist, kind of live your life. Um, I have a, I think I know part of this first question, but how many hours do you work typically?
it's
Being
not.
that today is Sunday and you're working today, or at least a little
Well,
bit
and
more.
that's a great point. Like I try to give myself 1 day a week where I don't do anything, but if a patient calls, I'm going to be there. When you want to practice, you on call 24/7. I usually work 9 to 9. Again, I'm in someone else's clinic from 9 to 5 roughly, and then my office from 6 to 9 at night. Um, I'm just in the grind mode. That's just how it is. But um, Sundays, I try to give myself that day. Meditation, yoga. If I once it warms up, I'll play golf. I love football, so football Sunday was like my thing. I'd go watch the games. But you got to give yourself like 1 day a week where you don't do anything. Ironically, I have a bunch of um, insurance cases to submit, so I'll be here for a while today. But typically, I try to take Sunday off.
Gotcha. Hours of sleep per night, especially when you're working 9 to 9 and got other things to do. How many hours do you typically get to sleep?
I shoot for 7. Shoot for 7 hours.
And do you
That's like
take do you take call? Are you taking call both in your office or other offices? How does that work?
only my office. I'm not taking calling words. Only my office. If a patient has a question, I'll call them, but actually like going in and handling an orthodontic emergency, just my office.
Just your office. What about inquiries when you have to address some clinical cases after hours? How does that work for you?
Usually whatever office will reach out to me and then I'll just call the patient.
Got you. All right. Morning or night person? What
I
which
used to
which
be a night
one?
owl. I used to be a
Night
night owl.
owl?
I'm trying to work on becoming a morning person. But yeah,
Got you. Favorite color?
iridescent blue.
Iridescent blue. Favorite food and drink?
Drink or um,
Or
ooh,
drinks? Let's say drinks.
uh, I'm a big Buffalo Wings fan. Love Buffalo Wings. Like a good, it's got to be good. Like very picky about that. I don't know if you've been to Miller's Ale House. They have the best wings in Jersey. Um, Drinks. I drink a gallon of water a day. I stay away from any sugars and stuff like that. If I'm out socially, it's going to be a Makers and Lime on the rocks. But yeah, that's basically it.
Gotcha. Little bourbon and water, of course. Okay.
It's really
Favorite
all I drink.
place, favorite place to visit or to vacation? Because you got to have some reset time, right?
Anywhere warm. I mean, I'm not picky. Somewhere warm on a beach somewhere, absolutely. I'm not
Gotcha.
picky when it comes to that.
And you mentioned golf. Anything else you like to do when you're not in the office?
Uh, Meditation, exercise. I'm starting to pick up yoga. I'm very new to it, but kind of get into that. But I just love the idea of being able to explore more of the esoteric part of life.
Gotcha. Okay. So we're going to go into a final set of questions here related to like just some bonus questions, right? So for those of you that have been listening and watching, continue to listen and watch. Take down some notes if you haven't, especially with these couple of questions that are coming up. So related to common instructions that you as an orthodontist are sharing with individuals that you help. What are some of those common instructions or tips or even oral health advice that you give to the people that you're helping with their smile?
Relapse. People think after they get the braces off their Invisalign, the teeth are just going to stay that way. Retainers are a lifetime commitment. So talk to your orthodontist about different types of retainers. I do either the clear six retainers and or permanent retainers, but your teeth will want to shift on you afterwards. They're not set there. Um, Malocclusion is stable, so they want to go back to the old way. So retainers. I also talk about oral hygiene in brackets. Food love, plaque bacteria loves to get caught between the bracket and the gingiva. So making sure to teach the child how to get in there is very, very important. I sometimes recommend 3-month prophylactic procedures versus 6 months if I'm concerned about the child's oral hygiene. And then lastly, and most importantly, you'd be amazed how many skeletal discrepancies are out there, whether it's the transverse, the vertical, the AP. Um, when I diagnose a patient, the first thing I look at is the skeletal structure. Before I look at any teeth, even the soft tissue, I'm looking at the skeletal structure first. My diagnosis is the occlusion, skeletal structure, soft tissue diagnosis, and then I look at the teeth last. So please, 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 I honestly believe that every patient who's considering orthodontics definitely at least get evaluation with one, because I mean, this is what we do. We assess bone structure first. And I did a study, my own research when I got my master's at Case on just the transverse dimension. And my study found that 60 to 70% of patients have a transverse deficiency. I mean, it's like 3 and 4, like you know what I mean? Like
What
so,
does that
and
what does that mean what does that mean to people that may not know what that means?
so you want the jaws to line up appropriately when you're looking directly at a patient. So the transverse is looking directly at a patient is the top jaw and the bottom jaw the right width relatively. And I found that the top jaw is not lined up with the bottom jaw. I was so thrown by my results, I did the whole thing over again. I was like, this can't be real. And yet, no, they were accurate. So there's a lot of underlying skeletal issues that definitely need to be addressed. And with that this is what we do. For those who don't know, an orthodontist should start looking at a child at 7. Like, don't wait till the adult. I hear parents say they still have baby teeth. Let's just wait till the baby teeth fall out. There's so many more great things that we can do for a patient at 7 that when they're 15 we can't. We can remodel jaw bones. We can redirect the vector of growth of jaws. We can certain extent adjust the vertical, at a younger age or during a growth spurt. So please, please, please bring your child in at 7 for an evaluation with an orthodontist. The Manhattan practice, the pediatric dentist is there the same day I'm there, and I'm on him like every 7-year-old and up. Like, let me just take a peek real quick. And he called me in for a 7-year-old yesterday, and I said, "Mom, can we take a pan?" Look at the pan, he's got a canine growing directly into his lateral incisor root. So, he would have walked out the door not even knowing that unless I jumped in there and said, "Hey, let me take a quick pan." So, understanding the skeletal structure is so important. We do.
Yeah, that's screening, right? That screening at 7 years old. Great tip, great measuring rod of determining what's going to happen or what is currently happening skeletally that, like you said, most other people may not be looking at, but as an orthodontist, that's part of your foundation. So skeletal evaluations, occlusion, soft tissue, then teeth,
So the last thing is the teeth. That's the
then
last
teeth.
thing.
Right. And of course, our patients are the individuals that we help. First thing they're looking at is teeth, right? The spaces, the rotations, the
I got an
size.
overbite. Yeah,
I got an
yeah, yeah.
overbite, you know.
That's the main.
My,
That's the
my,
main shit complaint.
right, the teeth. Not even knowing that it had already happened before the teeth, before they even see the teeth. So
And, and one last point, I'm sorry to cut you off. If we don't do that skeletal assessment and address those issues at a young age, you're looking at orthodontic surgery when you're 25, and that's a tough thing to have your jaws broken, reset, in the right spot. So we can avoid that for you
yes.
if you get your child to us by 7. So
Oh,
yeah, I'm very big on that.
yes, avoidance based on prevention, based off of uh early interception. And like you said, 7 years old, 7 years old, 7 years old. That's the magic number, 7 years old.
7, 7, 7, 7.
7, 7, 7, 7. Right? That could be a winning number too. Right? Tips. Tips. We need some tips for those that are listening and watching, who are aspiring to become an orthodontist. What are 3 or 4 or 5 things that you would recommend they do right now as part of both their journey into orthodontics, and then even those that are maybe have now matched into a program, some tips for them throughout their journey in training as well.
We'll do that in 2 parts, actually. I
Two
want to go
two
back to
parts.
dental school, but
Yep.
do not be intimidated by dental school. Like growing up, I was very intimidated about the idea of dental school, even though I knew I really wanted to be an orthodontist. That's why I started off my college career as a finance major. I didn't think I was going to be able to pull it off. I would challenge, well, I tell you from my personal experience, no one dental school class is challenging. If you were to take just one dental school class, you would crush it. What's challenging about dental school is you have 15 per semester, plus your labs, plus board exams and everything else. So managing your time, and the tip is understanding how you take in information. That is the key to success in dental school. Time management and understanding how you best take in your information. Enjoy yourself. Best part of dental school for me was my friends. We went through this. I was 22 years old when I started dental school. We went through it together. I had 2 roommates. One was 23, the other was 23. We had a great time, but we also, when it was time to study, we studied. So my biggest tip for you is understanding how you take in information, time management, and then being able to create balance. Enjoy yourself, make some friends. We love DC. Like DC was awesome. When it comes to ortho, one, do your research on the program. I think the key to great programs are the attending to resident ratio. You want to have a lot of attendings. There are a million different ways to skin a cat in orthodontics. If you were to put the same case in front of 5 different orthodontists, we're all going to have a different plan, and we're going to swear by our plan. But they're all excellent. They all know what they're doing. All the orthodontists are phenomenal. They just do it their way. So with that being said, you want to learn every different way to straighten teeth. I was so blessed to be a case and having 30 different attendings, not to mention the ones that used to fly in across the world. So I probably got up to like 50. I learned a million different ways how to straighten teeth, and I'm a product of all of my attendings. I use a little piece of all of their teaching. Like every single one of my attendings had some kind of impact on the way I treatment plan. So, and to this day. So you want to find programs where there are a lot of attendings. And another key to ortho residency is you want to treat as many patients as possible. I think I had like 150 active cases or something when I was a resident. I took on so many cases because the more you see in residency, you can bounce ideas off your attendings, the better you're going to be when you step out in the real world and you're on your own. And you got to make a call. Because like in the real world, for example, the model when I was a partner in the previous practice, our Fridays were consult days, and there'd be 30 consults. I would walk into a room having not seen any records, anything. Mom's here, the child's here, records are here. And within 5 minutes, I could do a full-blown diagnosis and treatment plan, all while getting to know the child and making sure mom understands what's going on. But the only reason I was able to do that is because I saw everything already in residency. No case surprised me. I never walked in a room and was like, what is going on from here? No, like I've seen it before. Malocclusion repeats itself. You really want to take on as many cases as humanly possible as a resident and learn from all your attendings. Every single one of your attendings are important. and I use a little bit of all my attendings in my cases. So I appreciate and grateful for all the attendings I had in my case and bronze care too.
What about related to as a ortho resident? Any other tips on making sure that that journey and that training process, those training years are rewarding? Anything for those who have just matched into ortho and they're getting ready to start, or they're starting and they're still navigating that process? Any tips, any ongoing tips for them as residents?
One, take on as many cases as you can. You got
Yep.
to see as many cases as possible. Two, get knee deep in the literature. You got to know that literature forward, backward, up, down, right, left. Um, yeah, and that's the only thing we have to stand on is the literature. So, like back in the day when I was there was like a reading list, I think like 120 articles. You gotta know that stuff. Get deep into that.
Only 120? Just 120? That's
Well, I
it?
gotta be honest. I was in school 15 years ago, so I don't know what it is now. But yeah, I still look up stuff, read about, like, and it's ever changing too. Now we got the AI, and I'm getting into lingual brackets now. I love that idea. There's nothing on the front of the teeth. I'm starting my second lingual case Thursday. Um, so being able to evolve with the market as well is so important. I'm thinking and hoping lingual is the future, which it's fun. It's cool. So definitely being willing to evolve is so important as well.
And then what about, well, two other areas we want to hear some tips from, advice from, related to, you mentioned it earlier, which was one of the challenging things about being an orthodontist that's outside of school and now you're practicing, working, helping individuals, which was the admin part. Any advice for those that are in residency, how they can transition, the best way for them to transition into private
It,
practice?
Going to private practice. What I would suggest, if at all possible, it's not always possible, is some type of mentor when you get out. Real world orthodontics it's like with school, you'll have a patient brought to you, you put together a PowerPoint presentation of your treatment plan and diagnosis, and you present it to the faculty, and it's just like one patient. In the real world, you got 5 minutes to make the right call, create a plan, get it done, and move on to the next room. So having a mentor, if possible, would be great when you get out. I'm always a listening ear. I'm extraordinarily busy right now, but anyone wants to reach out to me, I'm always more than willing to help or um, offer advice. So a mentor in the real world is important. Two, understanding the work environment you're getting into. Like I said, there are different models out there. If you're the kind of person that wants to be more of the underserved and you might have 100 people on the schedule, wonderful. But understand what that day is going to look like for you. If you like more high end day and want to do that, just understanding the environment you're getting into ahead of time is going to be very, very important. And then also, whoever the owner is of that first practice, usually you're going to be an associate initially. Make sure they're comfortable with you treatment planning your own cases. Some owners kind of want to direct your treatment plans, and then others are more free flowing and allow you to treatment plan. When I was a partner, I had a lot of good friends work with me, and I told them, do your thing. If you have any questions, you can always call me. All the systems were linked in all the different offices, so just shoot me the MR number, and then I'll look at the case. But I trust you to do your thing. Go do your thing. There's others who want to control how you treatment plan, how you flow the day. And I'm not a big proponent of that at all. To each their own. God willing, one day if I have an associate, we'll have to see what I do. But when I was a partner, I was okay with them. Do your thing. You're an orthodontist, you're trained, you have a certificate, do your thing. So make sure you know what your owner, um, what kind of page he or she is on, if they're going to try to control
Yeah.
your treatment planning or not.
And then the last set of tips related and structured around those that are applying. to ortho residency? Any advice for them? I know
We're
you
applying.
mentioned about for those that are applying, I know you mentioned, initially you mentioned the list of programs and look for programs that have a lot of attending faculty. Why? Because you'll be able to learn a lot more from more people about different ways to straighten teeth and also the treatment plan, right? So that's one thing, looking for those numbers in the programs that candidates are uh, as candidates are developing their list. What else should candidates look for? Any tips or advice for those that are candidates?
Well, advice wise, they want to see you're passionate about attendings. They want to see that you're really interested in this field. So one thing that I did, I think I shadowed 5 or 6 different orthodontists, and I put that on my CV. Like I went here, like shows that I'm very interested. When I did my research in dental school, I did it with an orthodontic resident.
Mm.
If you anything you can do that involves orthodontics and you can put on your resume and you can also get experience with is very important. They want to see that you're well versed. They want to, when you're applying, when you're interviewing, which is very important. These programs, for the most part, are relatively small, 5, 6 residents. They want to see that you're going to be able to properly fit in and flow with that group. Last thing in the world you want is to have someone who's like the black sheep of a group. You want people who can get along, work together. It's a small environment for 2, 3 years. So a lot of these programs will have a mixer. Like you'll do your interview during the day, and they'll have an evening mixer where you just hang out with residents. Um, you want to work the room. So what I did was for example, when I interviewed with Case, we had a mixer at Winking Lizard, I'll never forget. And I studied all the residents. I knew each face, their name, but in a mixer, there's the 10 residents and then there's 30 applicants. So I made sure within the 2 hours, 3 hours you're there to speak to each resident, but I also spoke to all the applicants too. They want to see you being. You shouldn't be standing in the corner with a beer. Like you need to be talking to people, joking with people. I met every single person in the room because even if you're not talking to one of the residents, they're looking at you. And they're like, oh, he's pretty cool. Like I had the whole night, he was talking to somebody. You know what I mean? You got to be able to fit in these small programs because it'll be a nightmare of an experience if you're the black sheep or you have a black sheep. I've seen things I'm not going to mention. So you want to be able to fit in well with the group, and that's what they're looking for in these interviews during the breakout sessions, the social sessions.
Yeah, and you don't know as you're mixing and conversing, you don't know who's looking.
Someone's watching you.
Somebody's watching, even if it's the big ortho tooth fairy up top. She's looking down, but there's
Somebody's,
also she got representatives in the room that are looking too,
yeah.
right?
Also, when you interview, do your research on the school. They want to
Yes,
know that you're as interested in them as they are in you. Like
yes,
I got a question. I
yes.
was like, I always get the question, why this school? Why Howard? Why Case? Why all the different places I interviewed? And I knew that the night before, I knew that program. I told them back to them everything that was on that webpage. And I was truthful about it, but I knew everything about that program before I stepped into that interview. That's very important because they want to know you care. It's kind of like a little bit like a gamble with the match. Like you can rank your top people on they rank their schools, but if you really like X, Y, and Z and they don't really like you, you're not gonna you're wasting almost a slot. So we want to see in an interview that hey, you're just as interested in us as we are in you. And so when you get that question, why Indiana? Why whatever program? You better know that program forwards and backwards. So you know that webpage, read it. Also, if you know any of the residents in the program already, reach out to them. Call, say, what is the interview process like? What are the kind of questions they ask you? A question that I think is asked every single time is, what is your definition of integrity? I think a lot of programs ask that question. And I wasn't even, I had a great answer. It just kind of came out, but I wasn't ready. Like, no one told me that question was coming. But that's not, I mean, just, do as much research as you can ahead of time.
Very key. Very key. A lot of different things related to tips and advice for both your journey in dental school, but then transitioning from dental school to applicant for ortho, and then also as an ortho resident, some things that you should focus on as part of your journey, right? As part of your journey. Last but not least, if you could change one thing about our dental profession, inclusive of ortho or outside of ortho, but just in our dental profession, if you can change one thing, what would it be and why?
More financial aid for care. There's a lot of children, a lot of people out here who deserve to smile, who need to smile, who have really debilitating occlusions, skeletal discrepancies, bites, whatever the case may be. And the scary thing is there's a bill that just passed in the House that wants to cut a lot of funding for like Medicaid, Medicare, things of that nature. And I'm hoping for the opposite. I want them to increase the amount of spending and financing to help people smile, help restore the mouth. But we really need to invest more in our people. And I'm just praying that somehow we figure that out. But if I could change something, the government would put more money into helping oral health department, helping people smile.
Yeah, and that's key. And the fact that you mentioned that it's come down, what happens in dentistry and how dentistry is delivered, how it's paid for, and how it's accessed comes down to individuals who are not dentists, who are not physicians. If usually 99.9% of the time. So that 0.1% of the time is up to us, right? We can hope, we can pray, we can also advocate. And that's another thing that's so very important to share with everyone, that as dentists, as oral physicians, overall, we have a duty or responsibility and obligation to advocate for the profession, because if we don't, someone else will. And it's usually someone else that typically does not have the same perspective, never been to dental school, maybe never had a toothache, never had a friend or family member that had some kind of oral health crisis or overall healthcare crisis that maybe originated in the mouth, which they didn't even know, or had a skeletal or an abscess, skeletal deformity or crisis that was getting ready to happen because they were not screened at 7 years old, right, for some interceptive care. My point is the importance of us as dental professionals advocating for ourselves, for the profession, and not making the mistake of continuing to let others advocate for us, because they're going to advocate what's for them or other people that may not be us, right? Very key. They not like us. They not like us. But we have to tell them why they're not like us. And that's the advocacy piece, that advocacy piece related to making sure that oral health matters, and we tell the reasons why, right? One of the things we want to find out now is not necessarily why, but how. How can people contact you if they have more questions about today, but also about orthodontics and your journey? What's the best way for people to contact you?
Text me directly. Text me. I'm pretty easily to reach. I can give you guys my number, I guess, somewhere.
How about an email? Is there an email address that you prefer people to reach out to you?
Sure. I mean, you can reach out at gcopeland777@gmail.
Okay. And any other ways as far as social media?
I have a professional page. Please follow it. Garrison Orthodontics is on Facebook. Please follow me. And on Instagram, it's called Find Your Bite. That's my professional page on IG.
So IG at Find Your Bite. And great. And then also Garrison Orthodontics webpage.
Yeah. But Facebook is Garrison Orthodontics.
Gotcha. Well, Doc, this has been great. Thanks so much for answering and telling us all about orthodontics. 32 questions with an orthodontist, and we got some tips. We got some advice. We also got a look-see into a typical day based on the different models that you can expect to work in. We also got some common procedures, but also a protocol as to how the uniqueness of ortho and the things that you do and how you develop transformative results, right? Starting from the skeletal, going to the occlusion, going to soft tissue, and then also lastly going into the teeth, the thing that most people see first, but as a specialist, you see that actually last because there's other things that come way before that. So this has been great, and hope you guys have enjoyed it. Share it, comment, but also go to the next episode. Go to the next episode right now. Go.